Hi, everybody. We've got a few people that are getting logged in here. We're still waiting on our presenter, Priscilla Easterling. Hopefully she'll be here soon. Hi, Randy, Chris, Belle, Elisa, Holly. Okay. Familiar faces and names there. Just to let you all know, I'm gonna leave the meeting early. And Ashley Tabor, who is on the call today, she will end everything when our presenter is finished, but I will be leaving. I have a dentist issue I need to take care of, so I'll be leaving at 12:30.
Hi, sorry about
Hi,
that.
Patricia, or Priscilla, I'm sorry. Um, I'm glad you were able to get logged in here. We were starting to get a little nervous. I'm
Yeah,
Laura with the coalition, and I was just saying that I'm gonna have to leave early. I've got a dental issue that I have to take care of. But Ashley Tabor is here, and so once I leave the meeting, she'll be taking over and close everything up. And looks like we've got about 11 people logged in so far, so we'll give it about another minute and then
awesome.
we'll get started.
Awesome. Thank you. And sorry, my internet was being a little fuzzy, so I have my slides. I haven't gotten kicked offline yet,
Okay.
but I might have to go on camera if it gets a little too dicey. But other than that,
Okay.
I'm ready to go.
All right. Are your slides something that can be shared after the meeting?
Yeah,
Okay.
absolutely. I'll send them to you now.
All right. And how do you prefer that we take questions? Do you want to wait till you present and then do it at the end? Or are you okay with people putting something in the chat or raising their hand?
They can put it in the chat. They can raise their hand, come off mute. I love an interactive
Okay.
as we're going along, so that while we're going through, if people have questions, ask it then, so that they don't forget by the end. So yeah.
Okay.
And I'll moderate the chat just to.
Okay. Thanks, Ashley.
Yeah.
We can't see her face, but she's here.
Hey, Ashley.
You can see me for a second.
There you go. All right. Well, let's kick this off then, officially. So Priscilla's here and I'm here and Ashley's here and we've got 13 participants so far. So there will probably be a few more join us. So I'm just gonna turn it over to you, Priscilla, and let you do your thing.
Awesome. All right, I am pulling up my slides really. Well, they're already up. I'm just making sure I can share my screen. Okay, great. So hi everyone, I'm Priscilla Easterling. I'm with Kentucky Voices for Health. I am our Director of Outreach and Enrollment. I am also a connector. So what I do day in and day out and what I've done is help people get access to benefits. Now, I primarily focus on health. I am not a SNAP connector, so I'm going to give you that caveat right now. I do not do much at all with SNAP, but I work very closely with SNAP connectors. Work very closely with our SNAP team for that are part of our larger coalition, our Thrive coalition, and we all understand that food is health, housing is health. You cannot lead a healthy life. You cannot be healthy without access to your basics like food and housing. So we talk a lot about how these programs intersect. And while my focus is health, definitely, I do have information about SNAP that we'll go over today, about some of the exemption, some other feeding programs. And then just generally, please answer if, as we're going along, if you have any questions, please don't hesitate to raise your hand, come off mute, put it in the chat, any of that. I prefer asking questions as we go along. Also, make sure to leave some space at the end if there are questions, but I prefer to do it as we're going along so that you don't forget it, because I don't know about y'all, but that happens to me quite often. That sometimes if during an hour-long webinar, there's something that piques my interest at the very beginning, and by the time the actual Q&A pops up, I've totally forgotten about it, or I focused on something else. So if something comes up, or if you need more information, don't hesitate to come off mute and interact a little bit. So I'm going to share my screen and go through these slides. I'm going to tell you now, I have a million slides. It's a lot. There's a lot of content. I will share these slides afterwards so that you have them. But a lot of my focus, especially as a connector, is working with Connect and the benefits that are on Connect. And so I'm going to walk through a just overview of like Connect itself, what is on there, how you can apply, what programs are on there. We're going to spotlight Medicaid and SNAP specifically, and then talk a little bit more about Connect resources, which is also an underrated resource that not a ton of folks are using, but there's been so much work in it, on it over the last couple of years that it's becoming like pretty awesome. I'm not gonna lie. So really excited to spotlight that for y'all as well. So getting ready to share my slides and make sure, and as I said that, I just accidentally closed my slides. So I am starting off strong. Give me just 1 second. Here we go. Okay. So as I pull these up and start sharing my screen, oh my gosh. Wow, okay, my internet does not like this. All right, so what I'm gonna do now, instead of going with PowerPoint, I'm gonna go back to Google Slides because for whatever reason, my computer is not wanting to work with Google, with PowerPoint right now, which is fine. Google Slides is great. So we are gonna do that, sharing my screen right now. And can someone just in the chat confirm that you see it when I get started? Okay, I think I see it. Can y'all see it? All okay.
Yes.
Perfect. Now let's go to the front and get started. Okay, here we go. So as a connector and as a person who loves puns, I have to I make a lot of Connect commentary quite a lot. And so connecting to public benefits, community resources, and enrollment assistance. Again, that's not the last Connect pun you're going to hear throughout this conversation. So just be prepared already. So as I mentioned, I work primarily with Connect. As a connector, I very much focus on those programs because again, Connect is a wonderful one-stop shop that really allows Kentuckians to apply for a range of programs all in one spot, and that's connect.ky.gov. So some of those programs, there's the health coverage, and they've kind of split them out. So there's the health coverage side of things. That's going to be Medicaid, your qualified health plans, or what they call marketplace coverage. And then also like a very small program that very few Kentuckians actually are qualified for, called KI-HIP. We don't talk about KI-HIP because it's not necessary to talk about, but Medicaid and qualified health plans are the two big health programs that are available on Connect. That's where most people are enrolled. That's where most people get their coverage. There's also the benefits side of Connect. That's going to be SNAP. Medicaid is technically folded in there because of the way that they've outlined the program, but I fold Medicaid under health coverage because it's much easier. So then SNAP, CCAP, and then KTAP, and hopefully in 2025, WIC will also be available on benefit to apply for on Connect. So that's really exciting. We're going through the federal approval process right now, and hopefully in the next, not 2025, but 2026, connectors will also be able to help people apply for WIC. So it's a very slow process, but also just makes that Connect program so much stronger. One-stop shop, here's all of the things that you could possibly need all in one spot to just make it easier for folks as they're trying to find resources and help. And then the last part that I mentioned earlier, Connect Resources, it is really growing as a really growing. The website has a whole host of local resources that help with food, transportation, housing, employment, finances, all of those things. And you can find resources in your community, which it's pretty great. We'll walk through that as well. Like I said, the two programs we're going to talk most about today are going to be health coverage assistance and food assistance. That third bucket of premium assistance, that's at KI-HIP, again, never talk about it. If anyone asks you about it, just like, no, that's not a thing. Let's ignore it because it's just such a small program. Healthcare coverage, Medicaid, K-CHIP, qualified health plans, they're all bundled together, even though they do tend to like outline them separately. It's kind of bonkers. But first, let's talk about Kentucky Medicaid. So Kentucky Medicaid it's a state and federal joint program. It's joint funded that provides health coverage for eligible low-income residents. So that is everyone really across the board. Medicaid is for everyone, and we'll go into that a little bit more. But very specifically, children, low-income adults, parents, pregnant women, literally anyone who is at 100, who makes their yearly income is at 138% of the federal poverty line or below. There are some additional programs like for the elderly where they can be jointly eligible for both Medicaid and Medicare. But again, Medicaid is just such an incredible program. It provides comprehensive health care and it's all free. There are no premiums, there's no copays. It is free to use and enroll in. And we hear other issues with it, but there are no costs associated with Medicaid. I meant to put the slide before, but before we talk about, when we're talking about Medicaid, really, we are talking about 1.35, it's actually a little bit lower, 1.35 million Kentuckians who are enrolled in Medicaid. That's a lot of people. It's almost 1 in 3. It's a little less than 1 in 3, and at this time last year, it was a little over 1 in 3. So there are a lot of folks who get their coverage through Medicaid. Of the 4.4 million Kentuckians, there are the vast majority of folks, the vast majority, 4.18 million, do have some kind of insurance, which is good news. That's exactly what we want to hear. Most people have some insurance of some type. There are still about 250,000 who are uninsured. We actually think that number is a little bit higher. That 250,000 is based on the last census data in 2020. And since then, there was that unwinding of the public health emergency and Medicaid renewals restarted for the first time since the pandemic. And we know that lots of people lost their coverage. At least 300,000, 350,000 or so folks lost their Medicaid eligibility now, and we don't know exactly where they went. Did they get coverage through their employer-sponsored plans? We know some people got coverage through a qualified health plan that connects Marketplace under private insurance. We know some of those folks did have Medicaid and transitioned from Medicaid to Marketplace. But for those other 350,000, we don't have a really good idea of where those folks went and if they're still covered. So we know that number is a little bit higher. How much higher? Not really sure. But looking at the public health insurance and private health insurance, again, Medicaid 1.55 million, that was as of, honestly, that was as of April. There has been such a significant reduction in the last couple of months as some of those final Medicaid renewals were processed, but still over 1 million people are getting coverage through Medicaid. And then for the Connect, and then through the Marketplace, around 85,000. That number fluctuates throughout the year. We know that over 100,000 people have enrolled in a qualified health plan so far this year. But because there are costs associated with that, sometimes that's not able to be, that's not sustainable for some folks. Income changes, life changes, people move, all of the things. And so that number fluctuates, but right now we're sitting around 85,000. So that's exciting. So going back to Medicaid, going too fast. So Medicaid is genuinely for everyone. Medicaid covers most Kentuckians at some point in their life. More than 50% of all births in Kentucky are covered by Medicaid. And that has been the stat since like the late 90s. Medicaid is such a crucial program for Kentuckians, and it covers most Kentuckians at some point. It covers 70% of nursing home stays and nursing home residents, and lots of other folks who just their income is not quite high enough to be able to afford a full price plan. There is often some conversation about, several years ago, there was a move for there to be work requirements related to Medicaid, that you should have to work to be eligible for Medicaid. But we know that the vast majority of folks enrolled in Medicaid are already working, and the adding in a work requirement is just adding in a paperwork requirement. It is just saying, here, document the thing that you're already doing. And we already have so many problems with documenting the current requirements, trying to prove income, trying to prove residency, trying to prove identity. All of those things already have so many burdens attached to them that adding in another paperwork requirement, adding more, that is just, it's bonkers and dumb. And thankfully the feds ruled like, nah, that goes against the rules of Medicaid. We know Medicaid is absolutely should not have work requirements, but we do still hear legislators who want to push for that. So just to be aware, most, if not all, Medicaid enrollees are already working. And if they're not, they have a good reason not to be. Or, how are you going to be a good employee or be able to work if you can't get the medication that you need, or you can't go to the doctor to treat the condition that is preventing you from being able to work? So lots of nuance around that, but Medicaid is genuinely for everyone and covers so many Kentuckians. So the Medicaid and K-CHIP income limits. So Medicaid is separate. Our Medicaid and Kentucky's Medicaid and K-CHIP programs are very, very integrated in Connect. So you are not able to like apply for Medicaid, but not K-CHIP. You're applying for all at the same time. And the system just is programmed to find which one you're eligible for. So for Medicaid is only for adults, or primarily for adults between the ages of 19 and 64 with income up to 138% of the federal poverty line. And then for pregnant women with income up to 218% of the federal poverty line. And it's like 213% plus a 5% disregard, same with the 138%. But K-CHIP is primarily for children who are under 19, and that is like birth to 18, the day of your 19th birthday, you're no longer eligible. And then you would be switched into Medicaid. It is very specific. And K-CHIP also covers pregnant women or women who are within 12 months of postpartum, as long as their income is at or below that 218% of the federal poverty line. And so some of the other really great work and benefits that are in Medicaid, we talked about, it's comprehensive coverage. It does, cover your PCP visits, hospitalizations, all of those essential health benefits. But now, up until last year, the thing that was being left out was adult vision, dental, and hearing. That's included for children, but not for adults. Well, as of last year, and it was finalized this year, Medicaid vision, hearing, and dental services are now available for adults. And so that was expanded for over 900,000 adults, which is just incredible. And just from the first 3 months of last year, when vision, hearing, and dental services were actually added into Medicaid and became a covered service, these stats, the 17,236 enrollees received like almost 18,000 hearing related services. The number that always gets me, 300,000 Kentuckians received 356,000 vision related services. Most of those are eyeglasses, but also eye exams, contacts, all of those. That speaks to how many folks really needed those services, but were unable to access them. And so just a very incredible work. And, we still hear issues with not enough providers, especially when it comes to dental services. But this is a great start. At least it's a covered benefit. We see what that need is. And now that we know what that need is, we can quantify that need. We can show, hey, look at all these people who got these services the second they could. That builds a lot of support for keeping these services and adding onto them and expanding them. So very cool. Another really great benefit that is being improved, being worked on is non-emergency medical transportation. I'm going to skip ahead really quick. So non-emergency medical transportation, we have a great explainer here that sort of walks through all of it. But it helps Medicaid beneficiaries get to like medical appointments, treatments, or pick up prescriptions. So all beneficiaries are eligible for free NEMT rides, but under certain circumstances. But trips to receive medical, dental, hearing, vision, mental health care, lab work, all of those like approved medical appointments, those can be covered non-emergency medical transportation rides. And just to like go back, non-emergency means it's not an emergency. It is your routine doctor's visits. It's your routine, lab work or appointments versus an emergency where you need to call 911 and get an ambulance. So there are, because of that sort of specific setting for these trips, there are some additional rules around about being able to book it. All rides have to be booked within 72 hours unless they're being discharged from the hospital or going to urgent care or something like that. But otherwise, you have to call a broker 72 hours in advance. You can't typically get a ride outside of your county, but it's really up to the broker if they're willing to make that trip. And then there were some rules around if you have a vehicle in the household. That was one of the biggest complaints that we've heard is that if you had a vehicle in the household or a vehicle in your name, you would not be able to schedule an NEMT trip before, period. Now they've made some changes, and so there's a new regulation that was just finalized like in June, where if there is a car in the person's name or in the household, but it's not deemed operable or usable. So, whether a big thing that we heard, someone had a car that was broken down in their yard, in their driveway, that it's not usable. They can't use it, but it's still registered to them. Before this regulation was finalized, that person would have to pay to get their car towed to a mechanic and then pay the mechanic to write a note that says, hey, this car is not usable. And that note, you could only get 3 notes a year. So, and they're only good for for a short period of time. And so that really, really made an EMT inaccessible for most people. We heard lots of stories of people who they only had one car in the household that they shared with their spouse, and their spouse takes it to work. And so now they can't use it to go to the doctor's appointment. Before, that didn't matter. It just meant that they couldn't take that trip. But now, if it's not usable, if it's not operable, you can still get a letter that attests that you're unable to use it. And a doctor can do that. School providers can do that. It doesn't have to be the principal. It can be someone in the front office. It can be a teacher or something like that. Mechanics can still do it, but they've really widened the pool of people who can also attest to a vehicle being inoperable or unusable, which helps make it a bit more accessible. There are still lots of problems with NEMT, but one of the first things that we hear often is that people don't even know that it's a benefit. They don't know that it's an option. And so again, just making sure that folks know this is an actual service. It's a benefit of being enrolled in Medicaid. And if you don't have a ride, NEMT is a really good way of a really good option for providing transportation. So, and then again, there's that explainer. It's linked. I have the slide. This slide is exactly what the front and back looks like. And it has all of the different brokers for the different counties. But the explainer is also linked there in the NEMT explainer. And it's also available in Spanish. So moving on. So as I talked about the federal poverty levels, the 138% for Medicaid. For a family of 4, that's 43,000 or below. Individual 20,007, almost 21,000. For K-CHIP or for pregnant women, it's 213 on here, but it's actually a little bit higher because, like I said, it's 213 plus a 5% disregard. So it's a little bit more than 66,000, probably 68,000 or so, 69,000. And then, actually it's a little bit, so around 69,000. And then for a family of 4, and then for a family of 1, that's close to 35,000. So the limits for adults being eligible for Medicaid are much lower than for pregnant women and or pregnant people and children. So I also like to always make that distinction for folks. Sometimes the parents could not be eligible for Medicaid, but because the threshold for kids is so much higher, the kids are eligible for Medicaid. And so just making sure if you know kids who are not covered, if you know that the income is just over the 138%, there's still lots of room for both children and for pregnant people. So let's keep going. And so now we're going to transition to a little bit talking about SNAP. So SNAP helps low-income people buy food and healthy meals at participating stores. And it really does, SNAP helps increase, it's giving specific cash in the hands of families to be able to buy food for their families, for themselves. I love that in here. It's like that increases buying power because it's just here's cash. Now you can only spend it on food. You can only spend it in certain places. So there are still limitations on it, but I'm always pro just giving people cash to solve problems as much as possible. I love this. SNAP is such an essential program. So looking at just like the state more broadly, looking at the state of hunger in Kentucky. So there are over 700,000 people facing hunger, and over 200,000 of them are children, which is just a very bleak number. And looking at this, about 20% of Kentucky's children are food insecure. Kentucky's largest city, Louisville, there's 1 in 5 Louisvillians living in a food desert. And so that just again speaks to the food scarcity and security, and how needed SNAP is, how necessary SNAP is to give folks the access to food and security, and knowing that they can buy groceries, that they can buy food for themselves and their families. So there are a couple of different anti-hunger feeding programs that we're going to talk about. So we're primarily focusing on SNAP. So that gross income limit is 200% of the poverty line. That's 30,000 for individuals, 62,000 for a family of 4. If we're looking at net income, it's about 100% of the poverty line, 15,000 for individuals, 31,000 for a family of 4. Unfortunately, U.S. citizens and some legal residents can receive SNAP. Non-citizen parents can apply for SNAP benefits for their citizen children. So if you are ever working with families where the parents may not be are non-citizens and aren't eligible for SNAP, they could still apply for their children. And that's also the same for Medicaid, if I did not specify that. So there's no problem putting them on the Connect application, and any parent, anyone who's on the application applying just for their children, they're not required, or they're not asked to provide a social security number. So just to call out, that's an available option as well. There's also WIC. I mentioned that that's going to be on Connect in 2025, with connectors helping hopefully 2026. The requirements for WIC: you have to be pregnant, breastfeeding, or postpartum, or the caretaker of children under 6. And that income limit is 185% of the poverty level. 57,000 for a family of 4. I do want to make sure to say that, or the caretaker of a child, because a lot of people do not know this. Men can be eligible for WIC. I know it's called women, infants, and children, but a lot of times people get stuck on that women portion. But just very specific, men who are caretakers of children under 6 can be eligible for WIC as well. So there's also the National School Lunch Program. We're a bit familiar with that. The gross income is 130% of the poverty line. Again, that really helps in schools, providing meals, things like that. And then Summer Electronic Benefits Transfer Program, Summer EBT. That is the transition from PEBT, the Pandemic Electronic Benefits Transfer Program, that gave cash to parents of kids to be able to provide lunches while they were, out of school, at home, not able to get that school lunch in the school. They've transitioned that to now a summer program, where households with school-aged kids over 6 if they're participating in that school lunch program and enrolled in SNAP, they can get, I believe it's $120. Oh, no, I messed myself up. I believe it's $120 for the whole summer. And that application is now on Connect as well. And it's really supposed to make up for those meals missed during those summer times, because for so many people, for so many kids, the only meals that they can rely on are the meals that they get in schools. And so, during the pandemic, we saw such a huge influx of people who applied for PEBT because they really needed that access to that money. They needed that cash to be able to afford meals for their families, for their kids. And so thankfully, wonderfully, they've transitioned that. We know that the pandemic had to end. Some of those programs had to end, but they've transitioned it to the summer EBT. So very exciting. And so this is just more of a like bigger picture, looking at monthly SNAP participation in Kentucky over time. The average SNAP benefit is $174 for an individual, $370 for a household. That household is a household of 4. We do just generally 1 in 4. But if it's a little bit lower, the benefit can be a little bit lower. If it's a little bit higher, the benefit can be a little bit higher. So that's the average. The total SNAP participants in June were 617,000, almost 618,000. We saw we've seen a small increase if you look at the end of this. Hope you can see my cursor, but if you look at the end of this, like 2023, you've seen this sort of steadily climb. As you know, we talk about inflation and jobs changing and all of these things. SNAP participation rate has gone up quite a bit in the last 6 months or so, and so now it's around 13%. The total SNAP benefits spent in Kentucky, 1.2 billion. That's such a big number. But all of that 1.2 billion, that also adds to our local economy. Where are people spending their SNAP benefits? At local grocery stores, at local, there are lots of local restaurants and community resources that offered like $double. That's what I was trying to think of, the farmers markets and things like that, where they're able to offer $double, so that each SNAP dollar can go just a little bit further, well, twice as far. And so all of that money it goes right back into our local economy, and it feeds our neighbors. It makes sure that everyone the folks who are eligible are able to spend that money to feed their families. And Kentucky is actually 46th in the nation for SNAP participation. About 65% of our eligible are actually enrolled. And so there's still that big gap of 35% of people who are probably eligible and are not enrolled for various reasons. There's lots of complex reasons why folks don't get enrolled, and one of the biggest one are those paperwork requirements. So, we talked a bit about work requirements for Medicaid. Those aren't a thing, but they are a thing for SNAP. Now, there are some exemptions, and so the counties that are currently exempt from having a work requirement, from having the time limit requirement, they are all in green. Both colors of green. That light green, they already had waivers last year. The rest of this dark green, all the way up into like Pendleton and Grant, and then down through the rest of the state, they all had they have new waivers as of this year. But everything in that red, Shelby, Jefferson, Oldham, that bullet, all of those counties, up to Kenton as well, all of those counties are subject to that work requirement and have to report it. And so let's go into it. So also another explainer about our SNAP requirements. So the SNAP requirements to report your work went back into effect last July. And so as of last September, those reporting requirements expanded to Kentuckians who are between 18 and 52 years old. So, but there are 3 new exemptions that started last September when that happened. So people who are experiencing homelessness, people aging out of foster care, and veterans. All three of these groups, they don't actually have to report any of their work hours. For everyone else, unless they're under 18, over 54, or pregnant, live in an exempted county, physically or mentally unfit for work, caring for an incapacitated person in household, substance use treatment, enrolled half-time in school, training work program, SSI applicant, working 80 hours per month or earning 30 times minimum wage, SNAP ENT, or unemployed. So for everyone else, they have to report their their weekly work hours, which again, that's just a lot of paperwork. And I think that's where we're seeing a lot of that abrasion, where folks are, it's hard to have to keep up with reporting all of that so regularly. And you're only able to miss it, I want to say it's 3 times, but I want to say you're only able to miss it 3 times before you lose your SNAP. So again, it's super, super important that folks know that there are these exemptions, and a lot of people fall into these exemptions. A lot of people hear about the SNAP work requirements and, assume that if they're not working, or if they, that they're just not going to be eligible. And there are lots of exemptions. So just want to make sure that everyone knows, here are all of these exemptions. There's also an explainer. It's also linked here. So make sure you know that there are lots of workarounds here.
Hey, Priscilla,
Yes.
I have a question about the SNAP exemptions for
Yeah.
people experiencing homelessness. So is
Yeah.
there a form that you fill out for that? And is there verification that people need to provide to kind of demonstrate that they are homeless?
There are a couple, so if you're doing it online on Connect, there is a specific question where you can answer it, that basically you can just put experiencing homelessness as the reason in there. Otherwise, there are some paper forms that I can try and connect to you. Like I said, I do a little bit less on the SNAP side of things, but I work with some SNAP connectors. And so if I can make sure to connect you to them as a resource as well.
Thank you.
Yeah, no problem. All right, so talking a little bit about WIC, it very specifically helps pregnant people, breastfeeding people, infants, and children under 5. The participation is about 106,000. We see again a little bit of a uptick in the last year. It's dropped back down a little bit. Right now, it's not enough people are enrolled in it. It reaches about 59% of the eligible families, but it really does particularly help with infants. And it has been, we've heard lots of issues with WIC and how hard it can be to access. And I mean, it's a lot of work for a relatively small benefit. The average monthly benefit is $43. I mean, sometimes that $43 is so important, and you'll do whatever it takes to get it. But for a lot of people, the amount of work does not match the what you're getting out of it. But it's currently going through and undergoing a modernization to make it easier to use, easier to access, and that's part and parcel of it being included in Connect in 2025 to make the application process and keeping up with any sort of case maintenance, updating documents, updating information. That'll be on Connect, so it'll be much easier to do all of that. And so, yeah, and if you know folks who've had any problems with WIC, we always recommend reaching out to Legal Aid. They are an incredible resource there and can really help navigate that process. Okay. Sorry, just checking the chat. I'm not paying attention as much as I should. So summer EBT, it also, like I said, we talked about it, it's $120 a child, and that went out to an estimated 580,000 for Kentucky. That's pretty cool. households with kids receiving SNAP, Medicaid, and KTAP receive benefits back in June. And then students who are between 6 and 18 years old as of last August that participated in free or reduced meals during the last school year can apply or had to have applied by this past August 15th. We are trying to like make sure I keep my timeline right. Looking for 2025, that number is going to kind of drop down to $40 per month per child, which is still going to be additionally about 120, but there's a discussion about adding in some a little bit more overflow so that it's like June, July, August, September, or May, trying to add just a little bit extra to make sure that all of that summertime is covered. But and then for 2026, it'll be $40 per month plus a cost of living adjustment. So also very exciting. And then here are just some of the resources for help with food assistance. Lots of food banks, senior meals, also a great resource as well. There are meal pickups and deliveries for food insecure seniors. I specified here Marie Callaway because they're one of our close partners, but there are lots of programs across the state that do senior meals as well. All right, so we're going to transition from program now to talking a little bit more about Connect specifically. But again, if you have more questions, feel free, hop off, come off mute, just jump in there or put it in the chat. But I am monitoring the chat a little less. When you go to connect.ky.gov, the great thing about it is, again, it's a one-stop shop. You will navigate a whole series of screens. And it's first you have to like set up a COG account. That part is a little bit cumbersome. But once you set up a COG account and you get into Connect, you sign up, you are gonna have to do some identity proofing. In order to do identity proofing, it all is tied through Experian. They're going to ask for your full legal name, date of birth, gender. They're also going to ask for your social security number, current address, telephone number. If they're unable to verify or connect any of that information to any of the federal or state databases like the IRS, the SSA, the Department of Homeland Security, those are their top 3 federal sources. If they're unable to do that, then you might end up in a separate process where you have to manually prove your identity. That's where you absolutely need to connect to a connector or go directly to a DCBS office, and DCBS will almost always tell you it's better to connect with a connector because they can do that process a little bit easier. Assuming they are able to, here's all of the information. What happens then is that Experian generates a set of questions based on all of the information that they have from the federal and state database, asking to verify that person's credentials. And those questions tend to be like, you had a credit card in whatever year, name the credit card that you have, and it'll give you a list of a couple of different credit card options. Or you went to a high school, what is the name of the high school? We have records of you living on one of these previous streets. Identify which street from this list of streets. What are the last 4 of your cell phone number? Like, some of them are super random. We do have issues sometimes with people being able to complete some of it, because sometimes the questions are also like, hey, you had a car loan at some point in your life, name who your loan was with. And if it was 20 years ago, a lot of times we run into people who don't have that information. They don't know that name. They co-signed someone else's loan, or they bought the car in someone else's name, or they bought the car in their name for someone else and has no information on that car whatsoever, or credit card or whatever whatsoever. And so sometimes there are issues where they're just not able to verify that. That's again where it goes through that manual ID process. Working with the connector, they can really help. And then the other side of things, sometimes people don't have enough of a credit history, because all of this, the identity proofing, it is based on a person's credit history. So oftentimes with like younger people, or people who have not had any loans, credit cards, anything that would have like hit their credit like that, they often are not able to complete identity proofing. And so that's, again, working with the connector, it's really helpful to be able to move past that, because you have to do identity proofing before you can even get to the application. Alternatively, if you want to do it on Connect, alternatively, there are paper applications, or you can apply over the phone. Over the phone is easy sometimes, because then you can just talk through it. The worker, whoever answers the phone, they're able to do the application for you, but you're also sort of running the gamble of what is a good time to call the call center, because sometimes they have obscenely long wait times. Other times you can get disconnected and it's hard to get reconnected. So lots of issues there, but definitely a solid option. Or you can always do a paper application, and the paper application has now been translated into, I think, 13 new languages. So that's also an option. Connect primarily is just going to be, the online portal right now is primarily just going to be in English, sometimes in Spanish, sometimes in Spanish. But any other language besides that, we recommend doing that paper application, because it's going to be a little bit quicker, or again, working with a connector who can do that for you. So this is just like the general outlay. We're not going to spend a ton of time on this. This is what the dashboard looks like. When you apply for benefits, there's a little tab at the very, very bottom that lets you apply for benefits. This is sort of what that program assistance, and notice KI-HIP is not highlighted because it is a bad, no, it is just not a program that people apply for often. You can also, Connect also lets you upload documents online, which is very helpful. So when you are going through and doing the application, sometimes they'll need more information, like, hey, we need, you claimed this income, you claimed this residency, can you prove this? And you can upload those documents online. They've now changed a lot of the document upload piece, and so it lets you, now they have a little, it's here too, where there's like that red, it's very small, this like little red dot that says not submitted yet. They've redone that, and so now it's like this, a full circle that is either green, red, or like half yellow. And half yellow is like, oh, you submitted it, but we haven't processed it. And that's based on a lot of feedback that people were uploading documents and then they just didn't hear anything back. They didn't know what happened to them. The documents seemed to disappear. So that's supposed to just help, like, hey, yeah, we have received it. You did submit this. We're still processing this. And they also put an estimated time of when they think that they'll have finished processing it. So that's also really helpful. You can also turn in documents by mailing them in, or taking them directly to the DCBS office. If you take them directly to the DCBS office, I recommend getting them stamped and dated, and making a copy. We hear not infrequently that sometimes people go into the DCBS office to turn in their documents. They wait in line, they hand them to the worker takes it and says that they've scanned them in, and then they disappear, and a couple weeks later, a month later, they're still asking for that document, or they'll say that you never turned it in. And so just making sure you have that stamp when you go in person and making a copy just protects you. So, okay,
Priscilla, we have about
Yeah.
5 minutes left and then we'll be at an
Perfect.
hour. So just wanted to give you that.
Yeah, love it. I'm so excited for that. So just for any of these programs, you always need to report a change if any of the following information changes. All of the stuff, it's all major like life changes or your income changes. That's all big stuff. And then if you need more help, always reach out to a connector. I've like way too many slides here, so I'm gonna like zoom through the last couple because they're mostly just screenshots anyway. So really, finding a connector is what my top recommendation for all of this is. If you have any clients who need assistance with SNAP or Medicaid, absolutely, if you feel comfortable helping them, do it. Yes, please. But connectors can be an incredible resource, and connectors can really like walk through the entire application process with you. So the rules for applying for SNAP are a little bit different because there's still an interview that the client has to do before they're able to be approved. But for Medicaid, for healthcare coverage, they're able to do the entire process, including upload documents and do all of that case maintenance. For SNAP, they're able to do the application, and then they can talk through a lot of the other program requirements, but then DCBS has to do an interview with the client. So there are a couple of different types of connectors. There are contracted connectors though, in all 120 counties. So this is how they kind of break down. KIPTA is the main group in Jefferson County and the Louisville area, but KPCA also has several connectors there as well, and so does Community Action. So there are connectors in all 120 counties. You can reach out to them, and they can help apply for Medicaid, SNAP, or CCAP. And again, hopefully in 2026, they'll be able to apply for WIC as well. And they can also do that case maintenance, report changes, recertify benefits, all of that. They do that education, they do assistance, and they connect to referrals and things like that. I'm going to skip through that. There is a find, it's linked here. There's a find a connector tab on Connect. So you can find someone directly in your area, in your county. And if they're across the top here, there are languages. So if you need someone who speaks a specific language, you can try and look for them there. There are only a few in the state who currently do. So it might need to be like a teamwork thing of trying to find an interpreter and a connector. And then you can also specify if you need SNAP connectors versus Medicaid or health. So and if you're also interested in becoming a connector, there is that room to become a connector, and our organization is getting ready to pilot a program where folks can get trained to be connectors under our already approved org versus having to go through the process of having their organization deemed connector org. So, and then just Connect Resources, last like 30 seconds and then we'll stop. So Connect Resources is a directory of program services and supports throughout Kentucky. And it has built-in tools for users to help facilitate connecting residents to those supports. And so it's really supposed to reduce barriers, find faster connections. Again, that one-stop shop while you're in Connect. We know you need healthcare. We know you need SNAP. What other services, what other needs do you have? And now they've partnered with United Way to really close that loop. So when you make a referral for something else, I literally, all of the words fell out of my brain that I tried to reach for. When you try to make a referral for something else, they follow up with that client and with the organization to make sure that those referrals are closed. And they've also instituted a new social determinants of health assessment that helps identify where those gaps in coverage or where those gaps in needs are, and then connect you to some resources there. So there's a whole referral process. These are some of the examples of what that social determinants of health. They do a red, yellow, green. So, you know, if you need life skills, if you need parenting skills, childcare, stuff like that, you're able to identify what those risk factors are all within Connect resources. So that's great. There are 6,700 organizations across Connect that are across the state that are currently in Connect Resources, and that's just growing by the day. That's 19,000 individual resources. So that's, again, very great. Here are all of the people who are involved. And then connect.ky.gov resources. So yeah, and we're gonna skip through all this. All of the explainers that I mentioned, we have our website, kyloop.org. They are all listed out here. And we also have a bunch of other great explainers, a bunch of other great resources that are cataloged by topic as well. So if you need assistance, if you need resources as you're helping others, we have a whole directory of resources there as well. So with that, I'm gonna stop sharing my screen.
All right, do we have any final questions before we wrap up? Maybe, no? All right, well, thank you so much for your time today, Priscilla. I just want to remind everyone that our next training session will be on September 9th, and that will be serving the aging population with the National Healthcare for the Homeless Council. The slides and recording from today will be sent out in the next few days. I hope everyone has a wonderful afternoon. And oh, somebody is asking, are immigrants eligible for benefits? Yes.
Yes, yes, asterisk. Some immigrants, depending on immigrant type, honestly, I hate to say it that way, but a category of immigrant, because some are eligible for some programs and some are eligible for other programs. So if you have more questions that I didn't cover or anything else, or Macy, if you'd like to follow up with me, I can. Here is my
Yeah,
email.
I was gonna say, when Laura sends out the slides and everything, we can put your contact information in that email. Okay.
Yes, perfect. Well, I just dropped in the chat too. So if you have burning questions right now, just feel free to email me, and then I'll send the slides to you and Laura. And so, yeah, thank you guys so much for your time.
Thank
It was a
you
pleasure
all.
talking with y'all.
Yes. All right. Bye, everyone.
Bye.